Hi, this is Dr. Bob Dannenhoffer, Public Health Officer for Douglas County. Usually I'm in the room by myself, so I take my mask down. I am by myself in the room here, but there's been a lot of questions about masks. What you should do, should wear a double mask, triple mask, quadruple mask? And I think we have really confused people with all of this data. The story is that I think masks work, and I think your use of masks should be tailored to the situation. If I'm out on a walk by myself, you don't need to wear a mask. This is not a virus that's gonna attack you from the skies. But similarly, if you were in an area where there would be high risk of transmission, let's say I needed to fly somewhere and it had to be in the airport or around people and whatever, in which case you'd want maximum protection. For the day-to-day stuff, going to the grocery store and whatever, regular mask is fine, either a surgical mask or a cloth mask. But if you need a high level of protection, let's say you're gonna have to be at a meeting with 10 other people, let's say you're gonna have to fly, let's say maybe you're in a situation where you can't be sure that the people around you are going to do it, then you should use the best mask available. Now, the very best mask available are those spacesuit kind of things that we used at the fairgrounds when we were getting people who were COVID positive. That would be great, but that's obviously not practical for daily use. The next best are the N95 masks, which are made in the US or sometimes in China. They're very tight-fitting. You test them with a thing called fit testing. So the way fit testing works is they put a hood on your head, they spray in a chemical, and if you can smell it, then it means your mask isn't working. If you can't smell it, it means your mask is working. Those are hard to use. They're somewhat hard to come by, and I don't think those are things people use all along. I think in general, a cloth mask is going to be fine, but let's say I needed to fly. Let's say I needed to go to a meeting where there was going to be a lot of people around. Then this is what I would do. So starting first, this is a cloth mask that my wife made. It is at least double layer. It's got a nose clip. You can see as I breathe, it doesn't fog up my glasses. And it's really quite comfortable. I usually find the masks are too short and they kind of right on my chin. This one goes under my chin and I think is really quite comfortable and easy to use. So this is what I would do for my daily routine, and people around town see me with that. Now, if I needed to, in addition, be in one of those high-risk situations, I would put a surgical mask underneath the cloth mask like this. So I'll take this down, and you can see that underneath the mask here, I've got a surgical mask. These surgical masks made of polypropylene work well. I hate them riding up and down my nose, so I use a piece of medical tape over that to keep them there. And again, this is fine, even with two masks. This is probably almost close to equivalent of an N95 mask, so it's good to use. After a while, get used to it. It's not a big deal. I'm going to take it down now so that for people who read lips, they can go ahead and see what's going on here. All right. So again, we'll start at the world and then move our way down. I'm sure there'll be a lot of questions today. So in the world, we're at 108 million cases, 2.3 million deaths. But the good news is throughout the world, cases and deaths really do seem to be declining in end of January and the beginning of February. Still active in Spain, Portugal, Israel, and the US. And in the US, we're at 28 million cases and 487,000 deaths. That's a lot of deaths. But cases are coming down and deaths are coming down. In the US, there used to be lots of hot spots. Now there's the occasional hot spot, but no one area of the country or one state which is particularly hot. Oregon is really doing pretty well at 126,000 cases and 2,200 deaths. So typically, however, Douglas County has done better than Oregon, which has done better than the state, than most states. But this week, Douglas County, which was previously quiet, at one point the lowest big county in the country, has been really, really hot. We've had, our last 3 days have been 3 of our worst day ever. So we have over 100 cases in 3 days. There were other 3-day periods where we had 10 or 20. So to have over 100 is a lot. And so what is going on here? I think there are 3 big factors here. One is that the schools have reopened. And as the schools have reopened, it's not the school itself, but it's everything associated with the school has also reopened. So when kids were doing distance learning, they were kind of at home, all by themselves. And now what we're seeing is kids going back to school. So they're riding the bus, doing other things with kids on the bus stop, going to school. And while we think the school's day itself is okay, they're then going to friends' houses after school. They're going to sports and being with their friends. So we're seeing lots of cases. We have 22 22 school outbreaks. So when you look at the map of the state, they have this map that shows school districts that are open, in hybrid, and for CDL. The ones in CDL are in red, the ones that are in hybrid are in yellow, and the ones that are open are in green. And you can see almost all of the green schools are in Douglas County because we've had a relatively low number of cases. But now we're seeing a lot of cases at school. And each of these cases have a lot of contacts. The kids at the bus stop, the kids on the bus, the kids in the class, the kids on the sports team. So that's why at this point we have over 800 people in isolation and quarantine. Now, I don't think it's the actual school day that's doing this. We have not seen any transmission, we think, during the school day. That is, two kids in the same class get it, or a teacher and a student get it. We don't think we've seen much or any of that. But what we do see is that when there's a lot of disease in the community, kids go to school. We also see that when kids are back in school, it was like, oh, this is over, we can relax. And then what we've seen is a lot of birthday parties and other kinds of parties that bring people together. The other thing that's contributed this time is a big nursing home outbreak. This nursing home outbreak was discovered on routine testing. They were just testing. They tested somebody. They were positive. They were not symptomatic at the time. They subsequently became positive. They tested again. And now we're over 35 cases in that nursing home. Now, most of the people are not very sick because the cases just started. However, most times people don't get really sick in the first week. It's usually the second week where you start to get really sick. So we're waiting with bated breath on that. The news is that in that nursing home, some people had no vaccine because they refused it. Some people had no vaccine because they were patients recently admitted. Some people got a single dose, and some people got 2 doses. And what we saw is the people who were vaccinated had good protection, over 80% protection for the people who got vaccine, even though they weren't 2 weeks past the second dose, which is sort of the golden time. Even without that, they had pretty good protection. So the vaccine really does work. This was not caused by the vaccine being there. It presumably prevented it from being even worse than it is. So that's what we've seen. And then we've seen a lot of gatherings. As I go around town and see big gatherings in restaurants, huge gatherings at the sports field, it really is worrisome. So we're worried about this. We're worried about this because all of this disease in the community usually leads to more disease in the community. And with so many people in isolation and quarantine, it's difficult to do the detailed case investigations that we're used to doing. One of the questions that's come up is, where are we going to be in the risk range? So the risk range, remember, is a 2-week range. It started on Sunday. We're now on Friday. And so we can have up to 224 cases to stay in the high range. If we have 225 or above, we move to the extreme range. I counted as of this afternoon, we had about, I think, 156 or 157. So we're going to have to really have very few cases over the next week if we're going to stay in the high range and not move to the extreme range. So be really, really, really careful in these next 10 days. Now, this disease has a typical incubation period between 2 and 14 days, but for almost everybody between 5 and 6 days. So really, for the next 2 incubation periods, the next 10 days, if people can really be careful about what they're doing, we hope we can bring the rate of disease down, and this will just be an unfortunate blip. Okay, so let me go to questions here. So someone says, I read about a new drug called XO-CD24 that has a success rate of 95% for treating COVID. Is this true, and how much promise does it hold? So XO-CD24 is an exosomal drug. So exosomes are the little things that bud off a cell membrane and release protein. So you could imagine that's the way that this spreads. So you have a cell that gets infected, the protein goes to the surface of the cell, it forms a little exosome and then leaves. So if you could somehow block that, maybe this would block the disease. So this is a drug that's been developed in Israel. It's in phase 1, which means they've only tried it in 30 patients. So they had 30 patients with moderate disease and they all recovered. Well, if you took 30 patients with moderate disease, statistically, you would expect them to all recover. And so it's a little hard to know whether they recovered because of the XO-CD24 or if they recovered despite the XO-CD24, or they got CD24 CD24, and it didn't make a difference. And so what you need to do then is you need to do a larger trial, and you need to then control it with compare it with a control group to see what the difference is. But 29 of 30 is pretty darn good, but doing nothing, you probably would get close to 29 over 30. But this is time to talk about other new drugs today. So there's a drug called Aplidin, which is a cancer drug approved for multiple myeloma in Australia, which actually seems in the laboratory to be quite effective, and they're trying it now in a phase 3 trial. So the good news on Aplidin, it's already been approved. So the safety and the manufacture and all of that is approved. And so moving it over to treat something new, so a lot of times what will happen is a cancer drug will come out for one cancer, and then they find it's good for another cancer, and then it's very easy to move from making it the indication for one cancer drug from one cancer to two cancers. Much harder for a drug like the CD24 because you actually have to show that it's safe and effective, whereas for something like Aplidin, you just need to show that it is effective because they've already shown that it's safe in treating myeloma. So the exo-CD24 is another one. We had a question last week about one called Viru-111. So again, cells are so fascinating. So the way cells work is that inside cells, they have these structures called microtubules. Think of them like little escalators that allow you to get from one place in the cell to another. And what the Viru-111 is, it's a cancer drug that disrupts the microtubules. And as it disrupts the microtubules, it doesn't allow things to move around the cells as much, and by not moving around the cells, it disrupts the replication of the virus. Again, it looks good, but it's still in early trials. Really, what we need is some phase 3 trials to see if it works. Other thing that we saw is a new one that came out this week. There's another drug out there called Actemra, which is a drug for arthritis, tocilizumab. And they did a double-blinded study in a hospital, and they showed that it helped, especially in addition to Decadron. So it wasn't a magic. It didn't do a lot. You had to treat 25 patients to see one patient improve, but that's not totally unreasonable. And so Actemra, in addition to Decadron for the sickest of patients, may be a reasonable thing. Also in the last week, there was a reasonable double-blinded study that showed that inhaled corticosteroids, a drug called budesonide, does help some, not magic, but it does help some. And so that's not unreasonable to try. And then a study came out this week that showed vitamin C and zinc doesn't seem to help. Ivermectin is always up there as being one of the effective drugs, and there's this guy in Wisconsin who is totally a zealot for this drug, saying it's a miracle drug. The NIH produced the relevant studies this week. It's a little hard to know, right? So, I use sports analogies occasionally, and so the sports analogies that the sports outcome we care about, did you win the game? And so at the end of the game, if the score is 6-3, you won the game, and that's really what we care most about. However, there could be other statistics along the way that would be interesting. Which side had the most strikeouts? Which side had the most errors? Which side had the most doubles? And so depending upon which outcome you picked, you could have this game that the Yankees beat the Red Sox 6-3. That's important to me, but let's just say the Yankees beat the Red Sox 6-3. And you'd say, well, the way I look, though, is that the Red Sox pitchers had 12 strikeouts, only 6 strikeouts for the Yankees. Well, that's a good thing that they had more strikeouts, but not nearly as important that the Yankees won the game. You could say that there was a shutout until the 7th inning, which would be great that the Red Sox had a shutout to the 7th inning, but then in the 8th inning, when the Yankees scored 6 runs, they still win the game. So really what you'd like to see in these studies, that the outcome would be death, right? That's what we really care about. None of the ivermectin studies showed any difference in death. What they show is like a difference in the viral load at 7 days, which would be sort of like the number of men left on base, or it showed, a difference in length of stay, which is important. These things are important, but clearly not the really critical thing. You know, the Decadron studies, and Decadron really does help. Decadron showed not only an improvement in these other things, but showed a decrease in death rates. Certainly the vaccine studies showed a decrease in the disease, which is kind of interesting, but which is most interesting is a decrease in the severe disease that caused hospitalizations or death. And so I don't know what to make of ivermectin. There's a lot of studies out there. Again, things that are a miracle, you don't need to argue about, right? Miracles happen, and when your miracles happen, all of the studies suggest that it really works. So for example, when Decadron came out, there are 5 or 6 studies now all showing that it works. With hydroxychloroquine, a lot of studies out there that show it doesn't work. And so we have to learn about these things. I don't dismiss any of these things. And I think right now, the ones that I would consider to be really effective, clearly Decadron is pretty effective. And approved and ready to go. So really, if you're sick enough, you should be on it. I think the antibody treatments or the antibody cocktails, at least early on, showed they were effective. There's some concern now with the variants they may be less effective, but I think there was some reasonable data early on that they were effective. The good news is that there's one clinic in town who is going to be giving that. So they're only giving it for their patients. So if you get sick and you have it, ask your doctor if they have this treatment available. Ivermectin, I don't know. Luvox, probably helpful, but I don't know. Pepcid, again, we still don't know. So there's a lot of data out here. You'd think we're about a year into this, that I would be able to give you much clearer data than this. And it's not because I haven't looked it up, and it's not because I don't care. It's the data just isn't there. Okay, so Carlos says, my primary care physician is Clackamas County. Well, that's a problem. I check with all the pharmacies you indicated, and they tell me I have to check in weekly for a very limited supply of vaccine. That is correct. There is really a very limited supply of vaccine. Is it possible for Douglas County to have one place to sign up for vaccine and tell us where to go rather than check with each pharmacy individually on a weekly basis? Unfortunately, each of the pharmacy systems has a totally different information management system. They don't usually work with each other. They have a totally different information management system that they can't get to work together. So I do not think this can work. In fact, at Bimart, for people who have called Bimart, they get the message that they don't have any COVID vaccine. I check with the people at Bimart and they say, yeah, that's because that recording is for all Bimarts everywhere in the world. And to change it just for the 3 stores in Douglas County is tough. So if we're talking about changing the voice message on their phone and how complicated that is, think of how incredibly complicated it would be for all these places to work together. So while we would like to do that, I do not think there's currently a possible way to do that. Now, the good news is I think we're going to get a little bit more vaccine next week. I think the pharmacies are each going to get a little bit more next week, but still not nearly enough for the patients we have. So it looks like we're going to have this week, between last week and this week, about 2,100 doses for seniors. So 2,100 doses for seniors. There's now 15,000 seniors between the 75 and above and the 80 and above who are eligible. So just not nearly enough vaccine. But the good news is the Biden administration tells us this week that they've ordered another 200 million doses. It looks like the Johnson & Johnson vaccine may get approved, and there's a hint that they've been making this vaccine, so they have some in the storehouse or in the warehouse, and then when it gets approved, they'll be able to let a lot come out. So we're hoping that when the J&J vaccine comes out and we have increased production from Moderna and Pfizer, that this vaccine shortage is going to be better. Yeah, so Benson says, what are your thoughts on the COVID-19 vaccine for people with autoimmune conditions and taking immune suppressants? The FDA says such persons may get the vaccine with counseling, but there's no specific data on the safety or efficacy for those groups. The J&J group excluded such persons, so we don't know. Given the mystery of autoimmunity, what do you know about this? And the answer is, I would totally agree with you that it is about as murky as possible. The whole syndrome of autoimmunity is a weird thing. You know, everybody with arthritis, everybody with lupus, everybody with Sjogren's disease, everybody with Hashimoto's thyroiditis. These are all people who are making antibodies against their normal tissues. which is kind of weird. Why would your body make antibodies against immunoglobulins or against cell proteins or against thyroid? Why would it do that? And the answer is that is one of the incredible mysteries of the universe. So why is your body attacking itself? And that's what autoimmunity is, your body attacking itself. And so the way we treat this is we try and, so the problem with your immunity system is not that your immune system isn't working. It's working in the wrong way. It's working against the things it shouldn't be working on. So typically what you would think on your immune system is it wouldn't attack your own body, but would attack outside invaders. With autoimmunity, you're attacking your own body, so it's not like your immune system is weak, it's just misdirected. So what we do then is we have people with these autoimmune conditions who take medicines that decrease your immune response. So if you look at all of these things that seem to be endlessly advertised on TV, Humira and all those things, these are things that slow down your body's immune response. Or you take prednisone or methotrexate, all these things that slow down your body's response. Those things are not good for you because your immune response is usually a good thing, but in this case it's misdirected. I think this one is impossible to know. So both in both the Pfizer and the Moderna trials, they included people with stuff like arthritis or whatever, but not nearly in enough numbers and with enough granularity for us to know, right? Because your situation, I've got rheumatoid arthritis and I'm taking prednisone and Humira, is maybe very different from somebody who's got lupus who's taking methotrexate. And I will tell you, there were not enough people in the studies who were taking lupus and methotrexate or had Hashimoto's and were taking nothing to go ahead and generalize about whether the vaccine is going to work or whether there are going to be problems. Now, the good news is we've now given it to millions of people around the country, and we have not seen troubles from people who've gotten the vaccine. So we've not seen troubles in people who have autoimmune issues who've gotten the vaccine. So I think at least in the short run, there aren't any safety signals. That's a good thing. But in terms of whether it's going to cause long-term worsening of your disease, I don't know. Whether you're going to get the same kind of immunity that other people get, I don't know. And the good news is that not that many people have autoimmune diseases. It's far more than we would hope, but it's not that many people. There's lots of us out there who don't have autoimmune diseases, and I think it's our responsibility to get protected to protect you. And so I would recommend that anybody who's eligible for the vaccine gets it. We know, for example, in the nursing home that about a third of the people who were eligible and were offered the vaccine did not get it. And that's how we think this disease got into the nursing home with unvaccinated people. So I think for you, for somebody with an autoimmune condition, I clearly talk to your rheumatologist about what they think. If they said, go ahead and get it, I think that's logical. If they said, why don't you wait a little bit, see if other people get protected, that would be great. So on the news, so Linda says on the news, it said that after your second dose, you're protected for 3 months. Is that true? That does appear to be true. If so, then what happens after 3 months? Well, again, remember the trials from Moderna and Pfizer ended in November. So December, January, February, we're not even there yet, so we don't know. What we've seen and what we're going to continue to see is these curves. And what the curves showed that people got the placebo continue to get disease at this rate. The people with the vaccine got the disease at this rate. And this rate here looks still pretty flat. So the vaccine was waning. What you'd expected to see is this would curve up. It's pretty flat, suggesting that it's probably going to last more than 3 months. But I don't think you know for sure until you've been out there 3 months. So Patty says, my 80-year-old mom got her first dose on Monday with no side effects or pain. Yes. I heard the second one can make you sick. Well, I think what we've seen is that the first dose is great. People have some side effects from it, but the side effects from the second dose seem to be similar to the first, but more amplified. On a one-person thing, after my first dose, I barely recognized I had it. A little sore the next day on the shoulder. After the second dose, I was really quite fatigued. It was last Friday. I was really quite fatigued and really didn't feel great on Friday night. But by Saturday, I was great. So I think you do have to be more concerned about the second dose. But again, it was relatively short-lived, and by Saturday, I was great. So Pamela says, I was wondering if I was able to get my second Pfizer dose on time. And so the story is, people are totally obsessed with this interval. stop it. It really does make a difference. The story is you can't get it before 21 days because your body hasn't learned the trick the first time that it needs the second time. So totally reasonable not to go less than 21 days. But whether you get the second one at 21, 27, 23, up to 42 is perfectly safe. On the Pfizer, they're going to, because they gave both Pfizer and Moderna on the event on the 23rd, I think next week they're going to do on that follow-up event. And getting the second dose at 28 days is perfectly fine. So people need to chill about that, about the timing on the second dose. I'll tell you, I've done a zillion vaccines. I figured this out the other day. Probably my patients have gotten 1 million vaccines. I couldn't really believe that, but it probably is true that my patients have gotten 1 million vaccines over my 40 years in pediatrics. For no other thing have we fretted over whether the second dose is 21, 23, 25 days. It's really not something to fret about. So Moderna's phase 3 participants are to be followed every 2 years. Have they released any information on the current level of protection of those who receive the vaccine? So again, they're continuing to do the graphs that show the rates of infection in the two groups. And I looked this afternoon, and the rates are still diverging, suggesting that people who get the vaccine still get pretty good protection. So, yeah, Kim says, our linemen, guys who work on the electrical lines that respond to 911 calls, along with first responders to power issues, be able to get the vaccine anytime soon. So those linemen are considered to be essential workers, right? Without them, the power goes out. And there are a lot of other essential workers, people who work in wastewater treatment plants, people who drive trucks, people who work in mills. These people, we have not yet decided in Oregon how we're going to deal with those essential workers. So the answer is, I don't know. So Christine says, my granddaughter is slowly getting sick with a headache, stomach issues, sinus issues, cough, and still has her smell and taste. I hope it's just the sinus. Well, it could be. And so the trouble with COVID, except for the loss of taste and smell, which is pretty distinctive for COVID, all the other symptoms are so non-specific. We cannot tell you how many people had COVID, went to work a few days sick, and we said, what were you thinking? I thought it was just an allergies. I just thought it was my winter sinus infection. And so it's really hard for people to distinguish. The answer is please, if you think you're infected, get tested. If you don't want to get tested, then really stay home for 10 days. So Debbie said, I read an article that those with gingivitis were 9 times more likely to have severe COVID. Is this something we need to worry about? So gingivitis are those red bleeding gums that you get. Gingivitis is sort of an indicator for overall health. So gingivitis has been associated with bad pregnancy outcomes, it's been associated with more heart disease, it's been associated with earlier death. So we think that gingivitis is a marker for inflammation, just like a haggard look is, people who look really old for their age are far more likely to get sick and die than people who look spry. And so gingivitis may be important, but there's nothing to suggest that if you have gingivitis and get it treated, you'll be better. But nonetheless, gingivitis is terrible because it leads to bad breath, it can lead to infections, and it can lead to tooth loss. So if you have gingivitis, please go to the dentist and please get it treated. So the Oregonian is reporting that 4 people who've had both doses now had COVID. Are these so-called breakthrough cases a concern? Casey asked. So I was just on the phone before I got here with the state health officer, and he said, okay, we've vaccinated tens of thousands of people now in the state. This vaccine is 95% effective, not 100% effective. And so what you may see in this is you may see an occasional case of somebody who's gotten 2 doses of vaccine who gets the disease. Now, we're taking these seriously, right? Because if you have the disease after you've had the vaccine, we want to check to be sure you don't have one of the variant strains. We want to check to be sure you actually got antibodies from the vaccine. So we're really working carefully to look at those. But the fact that there would be 4 in the state, that doesn't mean much to me. I'd expect there to be, for every 100 people infected, I'd expect there to be 4 in the state, because remember, the vaccine is not 100% effective, is 94, 95% effective. So the reason we give this vaccine is to both prevent you from getting disease, but also to prevent the spread of disease. And 94, 95% is still pretty good. So we're going to look at all those breakthrough cases. As I said at our nursing home thing, we had people who had 1 dose, some with 2, but they just got the 2nd dose, get it. So we're going to send those all off to see if there are variants. So Cindy says, why don't we have more vaccines? I think I know who this is, Cindy. Hi, how are you kids? The reason we don't have more vaccines is complicated. One is these are new vaccines that are hard to make, right? We're barely a year into this. mRNA vaccines are new kinds of vaccines. There weren't hundreds of mRNA factories out there just waiting for something to do. So you had to build both the mRNA factories as well as put all the vaccines together. The fact that we have as many vaccines as we have is pretty amazing. There's a question, though, of are these being evenly distributed? And there's a really complicated story. It does appear that Douglas County and other similar counties have gotten a little less than their share, and the state promises me they're going to make that up. Could a nursing instructor get one? I don't think. I think if you were just a college teacher, I do not think you can get one yet. Now, if you were a nursing instructor working in a hospital, you would get one because you worked in the hospital. If you were a nursing instructor who was 80, you'd get one because you were 80, but I don't think you could get one just because you were a nursing instructor. So Lynette says, do vitamins help to help with infection or help the vaccine? And especially vitamins that help strengthen your immune system. So vitamins are one of the most, I will digress for a moment, vitamins are one of the most interesting things in medicine. We clearly know that vitamins are important. And the way we figured out about most vitamins is with vitamin deficiencies. So the classic story is sailors would go across the ocean and they would eat hardtack, drink rum, and they'd have no fresh fruits or vegetables. And by the time they arrived in port, they would be really cranky. They'd have bleeding gums. Their teeth would fall out, and that's why you see these pictures of pirates with only partial teeth. And they would walk funny, and they'd call the guy who came to port the scurvy dog. And then what somebody found was that if you brought limes on board and people had a little bit of lime juice, they prevented scurvy, or that if you ate other fresh vegetables, it prevented scurvy. And then somebody figured out, oh, this is vitamin C. So vitamin C is in humans a required vitamin. It's interesting, most other animals make their own vitamin C. Somehow along the way, humans and greyhound dogs, for whatever reason, lost the ability to make vitamin C. So we need to get extra vitamin C out there. So lots and lots and lots of stories about vitamins, how lacking a vitamin can hurt. Vitamin D is the other big, there's all the rage the last 10 years. And so it is in general, when you see people who are low in vitamins, they are generally sicker than people who are high in vitamins. But that could be because it's the low in vitamins is making you sick, or it could be that people who are high in vitamins may be overall healthier. So for example, people who live at home, who are disabled, who never get out, have relatively low levels of vitamin D because they don't get very much sunlight. They may not get a lot of fresh fruits and vegetables, so they may be low in vitamin C, whereas the marathoners out there running 2 hours a day and drinking lots of fruits and vegetables and whatever may have both high levels of vitamin C and vitamin D. Well, I don't think the marathon runner is healthier because they have a high vitamin level, but they do. And so it's hard to know when you have low vitamin levels and high vitamin levels. Is it the vitamin level itself, or is there other things that go along with it? Well, we've tried over the years to supplement people who are low in vitamins, and it doesn't really do much to improve their health. There's some people go so far as saying the only positive effect of vitamins is expensive urine, because most of these you pee out, is that you make very expensive and sometimes fluorescent urine by taking all the vitamins. I'm not quite so down on vitamins. I think it's perfectly reasonable if somebody wants to take a multivitamin. That is great. But again, the story today on vitamin C and zinc is it didn't seem to help very much with the disease. In terms of the vaccine, we have no data. So Bruce says, have we seen any cases of fully vaccinated people being contagious? We do not think so. But again, remember the studies on Pfizer and Moderna just look for symptomatic disease. We didn't look for asymptomatic people who might still be contagious. So that is an unknown out there. It's interesting that in the cases from our nursing home, many of these people were asymptomatic and picked up just on a screening test. So we'll get perhaps a little bit, we'll get a little bit more data maybe from the outbreak here in Douglas County. So Judy says, per the Dunes Clinic, the vaccine call center won't be up till next week. Yeah, unfortunately. Again, you'd think that setting up a call center or changing the voice message on ByMart or getting all the computer systems to work together so you could have one standardized list would be a relatively easy process in 2021. Ugh, it's not. I mean, before I talked to the state health officer about the breakthrough cases, I was talking to the other person about how difficult it is for us to get data on the vaccines we've given. And one of the issues is we've got a relatively low rate of vaccines. But when we look, we know we've given more vaccines than we've gotten credit for. And we say, well, how did this work? So we know on one day, January 23rd, that we gave over 800 doses of vaccine in Douglas County, yet they only counted 642. So where are those extra 150 vaccines? And people are really struggling to help with the data. So yeah, you would think that setting up a call center would be easier. I talk to Paul Connolly several times a week. They're working really hard on it, but hopefully by next week it'll be up. So our inmates in jail locally being tested. So Douglas County Jail, which is here, we work with them carefully. They do have ability to test the people who come. They test quite a few people. They're not testing everybody on a regular basis. I do not think there's yet a recommendation to do that, but they're certainly testing anybody who's symptomatic. And knock on wood, we've not really had any. We've really not had any cases, any more than onesie-twosie cases there. We don't think we've had any spread. So Zay says, I am allergic to sulfur and bees. Should I be concerned about getting the vaccine? So another study came out today about the anaphylactic reactions. Early on, there was a flurry about that, but as we've given more vaccines, we see it's less and less common. The people who've had allergies to the vaccine typically have had allergies to other things like sulfa, which is S-U-L-F-A, which is not the element sulfur, the stinky stuff that's in rotten eggs. It is sulfa, S-U-L-F-A, which are a group of antibiotics called sulfonamides, like Septra or Bactrim. And the people who've had allergic reactions, most of them have had allergic reactions before, and sulfa and bees were prominently displayed. So, should you be concerned about getting the vaccine? Perhaps. But if you're allergic to bees, you should probably be more concerned about going somewhere and getting stung by a bee. So you presumably take a protection for that, which is that you probably bring your EpiPen with you when you go hiking. I hope you do. And I hope that when you go to the doctor, you say, please don't give me sulfa. But I don't think I would get much more worried than that. I would certainly go to a place when they gave you the vaccine where if you had an allergic reaction, they could treat you. But I don't think I would be super concerned about that. You know, we've given now many thousand in the county and not had no anaphylactic reactions. So Annette says, I'm a 61-year-old with COPD. Where can I get the vaccine? So the answer is people who are less than 65 with underlying conditions, they still have not set up the guidelines for when they're going to get vaccinated. That to me is tragic, but that's as best I know. It's probably not going to be until March at least. Sorry to say that. So Gabrielle says, is there anything new about the variants? There's something new every day. I could go on for hours, but we only have a few minutes. So the variants are that as any living organism moves and reproduces, it reproduces sometimes perfectly so that there are no mutations between one generation and the next. However, if there were no mutations, then things couldn't evolve, and we know that evolution is an ongoing process. So almost all organisms have a few mutations from one generation to the next. Some organisms have lots and lots of mutations. So for example, if you look at the HIV or influenza, they have a lot of mutations. You look at some germs like measles doesn't have very many mutations, and COVID is somewhere in between. And so the number of mutations you have is the propensity of a virus to mutate plus the amount of virus that's out there that's mutating. And so back at a time when HIV was so terrible in the late 80s and early 90s, there was a lot of HIV out there, and there were a lot of mutations, and there was so much mutations, it made it so very hard to treat. The goal now is to get people's viral loads down so low so that there won't be a lot of mutations. So it's how much a germ mutates in general and how much is out there. Well, for COVID, it's sort of in the moderate range. It's not in the low range or the high range, but there's so much out there. And so the variants that we saw that developed in countries and places where there was a lot of spread. So mink farms, and I know I focus on mink farms, but I think when this whole is written, the mink farms are going to be seen as one of the incredible contributors to variants. The UK, where there was a lot of disease in the southern part of UK, South Africa and Brazil and Southern California, where there's a lot of spread of disease, these variants started. There are now more than 5,000 variants. Some are just no big change, but there are a couple of variants that we really worry about. The UK variant seems to be more contagious, perhaps more deadly. The South African variant seems to be more deadly, more contagious, and seems to not respond as well to the vaccine, so not to get as much protection from that. The Brazilian variants are the least studied, and the Brazilian variants are perhaps the most worrisome because there are at least some anecdotal stories that places in Brazil that had a lot of disease in the springtime. So enough disease that should never go through again. They had about 70% of the people had the disease, so you'd expect that the next time around they actually had herd immunity. They got it the second time with the Brazilian variant and were just as sick as the first time, suggesting that it had mutated enough that your body couldn't spot the new one as something it already knew. That is what's really worrying. So people ask me what keeps me up at night. And I said this before Tony Fauci, but same thing that keeps him up at night is the variants, right? Because if you could promise me that the variants wouldn't be an issue, we've got this licked. Vaccines are coming, the vaccines are effective, we got this licked. But if we see by June or July that most of the cases in the US are the South African variant or the UK variant and the vaccine doesn't work as well, we are really, really, really in a tough way. So the thing that keeps me up at night is about the variants. So Joyce says, do scientists know how long the vaccines are effective after 2 doses? Again, remember, they just finished the trials in November. They do not seem to be losing effectiveness as of this afternoon when I looked. And again, so the way you know that is you have the people who didn't get the vaccine and they continue to get disease at this rate. People who did get the vaccine, they had that disease at this rate. If the vaccine starts to lose its effectiveness, that curve will start to come up to match the other curve, and we've not seen that yet. So we think for at least 3 months, the vaccines seem to be pretty effective. And because many people have that reaction after the second time, that reaction that you get after the second time is your body saying, oh, I've seen this before, which is your lymphocytes saying, oh, I've seen this before, I know what to do. And that's why you have the redness and the soreness of the arm, because your body says, I know what this is about, and it reacts to it. That memory, that lymphocyte memory, lasts a long time. And so the good news is if the disease doesn't change with variants, you might have good long effect. Maybe a year. I don't know if you'd get it longer than that, but let's say you got it for a year. That would be pretty good. I mean, getting a booster once a year for COVID isn't going to be a big deal, right? We get a booster. We get other kind of boosters, other kind of shots. That will be a problem, but a much less problem than we have now. So that goes to a thing called COVID arm. So a week or so ago, somebody said, oh, I got my vaccine, and a week later I had this red itchy rash, and it went away for a few days. What was that? Well, there's a name for that now. It's called COVID arm. So whoever called in with that, you are the proud recipient of COVID arm. This is a red itchy rash that starts a few days after the vaccine, typically around the area of the vaccine. It's anywhere from the size of a pencil eraser to it can be quite big on the arm. The arm is itchy, but that usually goes away in 2 to 7 days, which I think the person who had this told me that it went away in 2 to 7 days. It is what's called a late kind of response, not truly allergic. Have you ever had a TB skin test? So what they do on a TB skin test is they inject a little bit of tuberculin protein under your arm, and then they check it 2 or 3 days later. If your body has seen this tuberculin protein, what it does then is it forms a red area around it, and you say, you've been exposed to tuberculosis. Similarly with this, we think what's happening is that your body is, as it's instructed to do by this mRNA, it's making that protein, and you're having one of these late type 4 reactions that cause this, and that just means that it's working. But that also suggests that you have lymphocyte memory, and lymphocyte memory is really the key to all of this. All right, let's see what else I had here. So you see I gave blood today, so I have to drink extra fluids. So people say, Bob, why do you spend your time giving blood? I mean, there's other important things going on like COVID. And the answer is there are other important things going on like COVID, but there are also things that are important that are not COVID that are going on. Unfortunately, cancer has not taken a break during this pandemic, and much of the blood we use in the United States goes for people who are fighting cancer, and sadly cancer has not taken a holiday and they still need the blood. The other thing is that during the season, people still go out and hike and get in car wrecks. And the second leading use of blood is people who need blood after an accident. And again, we still have accidents even during COVID. So if you are able to donate blood, please think about donating blood. The blood supply has been okay in the U.S., but as many businesses have closed down, especially big factories, may have less people in them, there are less blood drives, so they really need your blood. Okay, so where should someone who doesn't have a doctor in Douglas County get tested? So first of all, people, especially if you're older or sick, you really should have a regular doctor. But if not, the urgent cares are all doing testing. So Nova, Evergreen, they all have testing. They all have good rapid testing. So if you think you have it, you should go to one of the urgent cares and they can test you. If you live in South County, Canyonville Urgent Care has it. So please, 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 if you think you're sick, please get tested. All right. Well, it sounds like it is time to go. Getting shoot out of here. So again, this has been a bad week in Douglas County. This has been our highest 3 days ever. And just a bunch of things came together at once. But we can do this. And what we need to do starting today is we need to say, we're in a little bit of trouble here. Really think about what you're doing for the weekend. Really think about wearing masks. Really think about if you have a gathering, say, hey, maybe we'll wait. Maybe we'll do it virtually and just see what happens over time. And we still have not met the extreme risk range in Douglas County. We still have a good chance of being underneath if we can keep the number of cases low, which I hope we can. And the way to do it is there's nothing fancy, there's nothing special. Be careful about gatherings. If you're sick, stay home, wear a mask, and be careful about social distancing. But above all, really be kind and be safe. If these variants don't become a big problem, we're kind of in the 6th inning here or the 7th inning here. We can really get through here. But if we let our guard down, let the other team score 11 runs in the 7th inning, it's going to be really, really hard to win this game. So again, this is Dr. Bob Dannenhoffer. Be safe and be kind. Thanks.